Welcome to this clinical guide on surgical wound dressing. We will cover the essential steps and techniques for proper wound care. A surgical dressing is a sterile covering applied directly to a wound. Its main purpose is to protect the site from contamination, absorb drainage, and promote the natural healing process. Let's begin with the step-by-step clinical procedure for applying a surgical dressing, starting with preparation. First, gather all necessary sterile materials, including dressings, antiseptic, tape, and bandages, and ensure an aseptic environment. Strict adherence to aseptic techniques is critical. Start by performing thorough hand hygiene, followed by donning sterile gloves. Now we move on to the core steps of the dressing application process. Gently clean the wound and the surrounding area using an appropriate antiseptic solution to reduce the risk of infection. Select the appropriate primary dressing based on the wound type and place it directly over the wound bed, ensuring full contact. If the wound has heavy drainage, you may need a secondary dressing, like an absorbent pad, over the primary layer for extra absorption and physical protection. The way you secure the dressing is vital. Let's look at the different bandaging techniques based on the injury location. Use the circular technique for firm support around a limb. The figure of 8 technique is best for securing dressings over moving joints like the knee or elbow. The recurrent method is specifically used for the scalp or amputated finger stumps. A cravat or triangular fold is ideal for head or limb injuries. Beyond simple coverage, a properly applied dressing serves several critical medical functions for the patient. Dressing acts as a physical barrier against contamination for infection control, and it absorbs exudates like blood and pus, managing wound moisture. Dressings aid in hemostasis and compression to control minor bleeding and reduce swelling. Importantly, they provide comfort by protecting sensitive nerve endings. Healthcare providers must be vigilant in monitoring for potential complications that can arise from improper application or poor wound reactions. Monitor for skin maceration, which is the breakdown of healthy skin due to trapped moisture. Also, prevent adhesion where the dressing sticks to the wound, causing pain upon removal. Watch out for pressure injuries caused by overly tight bandages, cutting off circulation, and always maintain aseptic technique to avoid infection.